Some issues that arose last week during the coronavirus task force call between council members and Dr. Caldwell, Dr. Jahangar, and others. And there were some concerns about lack of transparency and some questions about the policy currently in place right now about sharing data about COVID infections with law enforcement. I was not on that call last week, so if I could, I would like to ask Sandra Sepulveda and Colby Sledge to recap some of the issues that they talked about last week on the phone call so that we can all be brought onto the same page. And Sandra, if you don't mind, I'd like to start with you. If you could talk a little bit about what concerns were and what your concerns were during the phone call and your broader concerns about what's going on right now.
Yeah, thank you, Vice Chair. I think we've had a couple of concerns for a while now, and we have been on several calls trying to find solutions for them, but you know, we haven't been able to agree on the way to tackle this. So my main concern is, you know, just the fear aspect of it. My district has the largest immigrant population, and we are one of, if not the most diverse district in this city. And I have had a lot of people reach out concerned with their information being shared with law enforcement. And I have tried to reiterate the importance of getting tested, but it's a little difficult. You know, it's a little difficult, and people have many concerns, and they have a right to be concerned because, historically speaking, you know, it's been very hard for the immigrant community, and they just have a lot of fear. And like I said, I could preach all day. At the end of the day, there is a historical aspect to this, and I completely understand where they're coming from. My main argument and some of my suggestions were if we could ask, if we were having 911 dispatchers ask on the front end if they were asking people who were calling if someone in the house has tested positive for COVID. That way it's on a voluntary basis, and the first responders still get that information. That's a question I still have. I think it's still very important for law enforcement to wear a face mask at all times and to interact with the public as if they have COVID or are asymptomatic. I don't understand why there isn't a policy, a set policy for law enforcement wearing face masks at all time. Maybe there is, I haven't heard of it. You know, tensions are high right now, and there is a lot of fear, and it's not just in the immigrant community, it's also in the African American community. And I think we need to reevaluate this. Other states have figured it out, and I think we can as well.
Sandra, what do you think that they have said as the rationale for having this policy in place?
I think the main thing that I have heard is if we have this information that could protect first responders, why can't we use it? Or it makes sense to share it is the main argument. I think that there are precautions that we should put in place to guarantee the safety of all first responders. I think it creates a false sense of security.
Thank you. Colby, would you pick up on that and talk a little bit about what your concerns were about this and issues that were raised on the call with the task force on Thursday?
Yeah, sure. Thanks for letting me speak, although I'm not a member of the committee. So, you know, in the conversation we had Thursday, there were a couple of points brought up that, and I just want to make very clear that as of today, as we sit here, we are very possibly the only government in Tennessee that is sharing this data because the governor said that they would stop sharing data as of yesterday in that program. So acknowledging that, you know, we've seen now the reporting today that 20% of cases across the state are believed to be Latino or Hispanic folks who tested positive. We were bringing this up to say, look, we think there's been this sort of two-part conversation: people who aren't getting tested and people who are. And what we are hearing as members in this area is that there's a third group, and the third group is folks who might not get tested unless they speak to a trusted navigator, friend, family member, whoever it might be, and are convinced to go get testing. And part of that conversation is always going to bring up, you know, what's the involvement of government, and when there's any uncertainty there, the answer turns to no really, really quickly. And that's what's, you know, kind of been reported out there. That's where we're seeing. And I want to point out in these calls week after week, for those of us who've been on them, there has been a consistent request for race and ethnicity data. And the reporting has been spotty, excuse me. Some weeks we get that data. Some weeks, like last week, 90+% of the race and ethnicity data from testing at metro sites was marked as pending. So we had the best data we're going off of is either old data or geographic data. So there has been this assumption created in public health that, that this is where these numbers are coming from, but we don't have data to back that up. And that's something that we keep bringing up as members on this call. And we have also brought up on the call, you know, kind of, I've had constituents who have called and said, kind of, how is my data being used by the third party that's contracted with Metro? Because folks who fit the description that we're talking about are concerned not only about what's happening on the front end, but then where their data is going from there. And we have yet to get answers there either. And all of this, what we said on the call, is that it continues to undermine what little trust we're working on right now. And as a result, we know that there are members in the community that we represent who are not going to get tested because they don't have the faith that their data is going to be used correctly. And I think the call Thursday, there was a real disconnect between several of us members saying, it's not necessarily about how the data is used and all these sorts of safeguards and how they're notifying people. It's the front end, it's the chilling effect that we're going to have community members who never show up to get tested because of the uncertainty that they hold on the front end. It doesn't matter what kind of, again, quote unquote, safeguards get put in if folks don't show up to get tested in the first place. So that was the big, I think, gap that never got bridged in our meeting Thursday.
Thank you. I see Councilmember Porterfield with her hand up.
Thank you so very much, Councilwoman. And I share some of those same concerns that Councilwoman Sepulveda shared, as well as the concerns of Councilman Sledge. Unfortunately, I was not able to join the call on Thursday, but you know, we've been expressing these concerns since we were first informed that this information has been shared. I don't want to belabor the points that have already been made, but I'll just briefly say that one, in an effort to keep our community safe, to keep our first responders safe, our police officers our firefighters, anyone providing medical services, we have to treat every person that they come in contact with as though they have tested positive or as though they have coronavirus, but they're asymptomatic, because you do have so many people that are asymptomatic that are not getting tested because they're not showing any of those symptoms. So we can't rely solely on if there is a positive case of this person testing, because so many people are not getting tested. So if we want to be serious about keeping our Metro employees safe, then we need to make sure that we are treating them as though they tested positive. So we need to make sure that we have enough masks and protective equipment. My second concern is, this is an issue that you've seen people, kind of galvanize around from various backgrounds. There are concerns with members of the immigrant community not being tested because of their information being shared. You have concerns from the African American community about their information being shared. You have concerns from other political demographics that they're concerned with their information being shared, and there are privacy concerns here. So when you have various groups that are sharing the same concern, and people are explicitly stating that they don't want their information shared, we have to find a better way. So in no means, do we mean to put, we don't want to sacrifice our first responders and our police officers and firefighters. We're not saying put them in harm's way. We're saying come up with policies that are going to keep them safe. And you can come up with policies to keep them safe. There were concerns about if someone tests positive for COVID and then they, get arrested and they are going into prison or jail to make sure that, they're not infecting the population there. We need to just put policies in place to make sure that we're keeping everyone safe. And it is a hard task, but it's something that could be done if we're serious about doing it. If we have the will to do it, we can do it. So I'm standing in agreement with the council members that spoke, and we just need to find a better way to address this. Thank you.
Thank you, Councilmember. Councilmember Hall?
Morning, everyone. I too would like to just stand in support and my council colleague. I greatly appreciate the effort and the concern that Councilmember Sledge, Sepulveda, and Porterfield have echoed so far. And I've watched them work diligently each from whatever angles they can to make sure that this conversation becomes advanced. Predictability is a factor. And I come from it echoing those same sentiments because the reality is, back as early as March 9th, I know I was the first person to ask for the demographic information. I've been working with Dr. Hildreth at Meharry and wearing the mayor's office out and the health department out since then, because we knew as this outbreak took place, there were specifically going to be communities who were disproportionately impacted for a variety of reasons. It was absolutely predictable because of health care, because of access to health care, because of chronic illness and so forth. And so to find ourselves in a place where certain policies or mechanisms have not already been implemented gives me great pause. And so Councilmember Porterfield just hit the nail on the head with the phrase of the will. It comes down to one word, will. Do we have the will to do what we know is necessary? And at this point, even as we struggle with the budget and other things, we need to make sure these policies are in place so that we can make sure they're financed, so that those mechanisms to ensure longevity in support for those things. I know PPEs in particular have just been a chaotic process to make sure that every facility and every individual on the front lines that needs those has access to those. And so it absolutely comes down, as she said, to will. And we know that the policies can be put in place. This is not rocket science, guys, but we have to see the will and the initiative being advanced, because when across the board, you have multiple groups saying the same thing. I can tell you, we talk about it in the African American community, how many people are not being tested. There are fears and concerns from information being shared all the way back to historical content of what are you really testing me for, giving me, doing to me, that sort of thing. If anybody was paying attention, look at the reaction to going into MDHA properties to have people tested. How that whole thing was completely misconstrued, miscategorized, but it was based on real fear. And so I see and understand, as Councilmember Sepulveda said, that is a real concern in the immigrant community. And you can't ask these folks to jeopardize themselves and their status because we don't have the will to take some simple steps. So, yes, we've got to make sure that our frontline workers have everything that they need and are prepared to go out into these communities. And simultaneous to that, we're making an actual concerted effort to dispel the misinformation and fears so that we can have accurate numbers testing. Because this second wave is coming based on what has been happening the last few weeks and even over this past weekend. I promise you, we're going to want to make sure we've got the policy in place and that we've provided the things that we need to, because this next round is not going to be friendly. I personally believe it's going to greatly surpass what we've already seen to this point.
Thank you, Councilmember. Councilmember Benedict?
Thank you, Councilwoman. So I echo everybody's concerns thus far, all the speakers' concerns thus far, and I think that it's time that we make a change in Nashville and stand together and get some information out there that says that we want this policy to change. The administration has doubled down on this. The Director of Health has doubled down on this, and clearly there is not a need for this, given that we have appropriate PPE. Now, if somehow that changes and we feel the need that, there's such a scarce amount of PPE that we need to know, that our first responders need to know when they're heading into a location where people potentially have the virus, then okay, we might need to revisit this. But right now we have plenty of PPE, and quite frankly, I would say even if we did have scarce PPE, we need to assume everybody has the virus. We don't know right now who's asymptomatic. We don't know if 3 or 5 days from now, for everybody that was out this weekend, we don't know. And Dr. Jahangir said it this morning. We don't know when those symptoms will show up. It's usually 3 to 5 days. So if somebody gets a call today, we need our first responders to be in full PPE. So I think we need to come out strong as a committee and hopefully as a council to urge the Director of Health, and I guess maybe I'm making a motion right now. I guess I move that we create a
Point of order.
Sorry, go ahead.
Councilmember O'Connell, was that you?
No, it's Steve Glover.
Councilmember Glover?
I don't know that we can vote on anything, can we? Is Mr. Cooper on the phone?
Yes, I'm on the phone. Assuming that you have a quorum, there could be a motion to, ask somebody to do something. I would point out there is a resolution on the subject that will be considered by the committee tomorrow. So that would be the better time for a motion, but you could do something non-binding today.
Okay, that's fine. I just wanted to, because what I heard originally was that we went, and I said it, I didn't think we were going to be voting in the meeting. So I just want to make sure that we're staying with it. And then, Chair, I will hand back, but once that's done, I have a couple of questions.
Thank you. Councilmember Benedict?
Thank you, Councilwoman, and thank you, Mr. Cooper. So I think that as a committee, I hope that tomorrow we can show our support, and maybe heading into the meeting tomorrow that we call out that this practice just needs to end as quickly as possible. And again, if we receive information that there's a scarce supply of PPE, then maybe we revisit this. But we are reacting so quickly to everything. There's no reason why we couldn't say, stop this now. And if something changes with the amount of PPE that we have, such that we really have a valid reason to do this, I don't think we ever will, but let's just say that there is, we could make an adjustment in, within an hour, I'm sure, as it relates to a policy. So again, I don't see any reason to do this as Councilwoman Porterfield stated. We have to treat everybody, and as Councilwoman Sepulveda said, and I think Councilman Hall said it as well, we have to treat everybody as if they have it. So on every call, every first responder, and everybody should be wearing a mask all the time. I saw folks out on Saturday, some of our first responders out on Saturday that didn't wear their mask 100% of the time. We need to have a zero tolerance policy within our public safety departments that, and all of us too. We need to have we need to wear our masks in public. We need to wear our masks in the chamber. Should we go into the chamber, we need to keep our distance. As we tackle this virus and continue to tackle this virus, we need to make sure we're protecting our most vulnerable communities and also setting the example. So I would just urge that this committee somehow find a way between now or tomorrow, if it needs to be tomorrow in committee or on the floor. We need to come out hard against this and strongly urge the administration to make a change as ASAP. Thank you.
Thank you, Councilwoman. Councilmember O'Connell. We cannot hear you, Freddie. Are you unmuted?
There we go. Just took a second to unmute. Thank you, Madam Chair, and also this committee for convening on this topic. I know we've kind of gone, on the history of this, we've gone from a call with some members of the Southeast delegation that I was aware of. We've certainly seen this come up now in both public briefings and in a special council briefing specific to COVID-19. I think here's what troubles me the most is if somebody asked me today, what is our policy on this? I have no idea. Right? There seems to be an MOU that exists between the Metro Public Health Department and Metro Nashville Police Department. I haven't seen that MOU. I think it's important to surface that MOU. If we have a policy about data sharing, we should be, I think that's the fundamental thing for me here. We are trying to offer an effective response to a global pandemic at a local level. And we are also, I think that does not mean that we suspend a key principle that we are dealing with sensitive personal health data. It is absolutely possible to construct a system wherein you respect people's privacy with regard to their health data, and you also respond effectively to a global pandemic. And I honestly don't actually have a problem if at the Emergency Communications Center, if even in a patrol car, that in a request for service, an address is identified where someone might be COVID-19 positive, that's okay. But shipping an entire database outside of the domain of the Public Health Department to the ECC, to MNPD, is highly problematic. And if I am asked by anybody in a vulnerable community of color right now in my district that already has low trust in law enforcement, especially given what has happened right now, I don't know what to tell them. Right? If they're saying I should go get tested, like my employer has required me to go get tested, but I'm here in an undocumented capacity, or someone at my house, I know, if MDHA has a zero tolerance policy on possession that actually extends to anybody staying in a unit, like I'm concerned that my daughter's boyfriend might have, a joint in our apartment. And now I'm on a list that law enforcement could use to just come and knock and see if I show up as COVID-19 positive. These are very problematic scenarios about the use of personal health data. And we have not made any assertion other than we're going to use all tools available. And we need to make the assertion, you can count on us being mindful of the privacy of your personal health data as we work to keep the spread of COVID-19 as small as possible. I think that needs to be where we go. So thank you again for allowing me to speak here.
Thank you, Council Member. So what I am hearing is that we are actually dealing with several issues here. One being a lack of transparency and effective communication from the Metro Health Board and possibly Dr. Caldwell, and also what we are doing with private information like testing results from COVID, which could put us on the wrong side of HIPAA laws and perhaps even hold Metro liable. My understanding is that there is not an MOU on file. Mr. Cooper, can you verify if there is in fact an MOU on file about what we are doing with that data? How we are handling that?
I don't know if there's an MOU or not. I haven't seen one, so I can't say for sure.
So I think if we go on the assumption that there is not one, I think that potentially could put Metro in a legal liability position because that is federally protected health data. Am I correct in that, Mr. Cooper?
There's actually a specific exception in HIPAA for sharing information with law enforcement. So I think that would cover it. I'm not a HIPAA expert, but I think that that would be enough to protect us from liability.
Vice Chair, the CDC, sorry.
Oh, go ahead. I'm sorry.
I was just reviewing this information an extra time this morning. The CDC does have specific guidelines that allow local governments to do this.
Okay,
unfortunately.
thank you.
However, most have chosen not to.
Thank you. Councilmember Hall, your hand is still up. Is that from before? Do you have something else you'd like to say? Councilmember Hall?
It was from before. Let me take it down.
Thank you. Councilmember Sledge?
Thanks. Just one quick addition on this MOU conversation. I mean, part of the discussion we had Thursday and quite frankly afterward with different officials was part of this whole like talking about an MOU and you know Chief Swan was saying like it was almost done but nobody had seen it, and to Councilmember O'Connell's point, I think several of us on that call kind of gave, whether explicitly or implicitly, the thought that we are spending all this time on an MOU or some agreement or trying to tweak a policy that is just fundamentally flawed. And a lot of us are concerned that all that time spent and energy spent on trying to figure out what the little, you know, stuff around the edges is time and energy better spent trying to get people comfortable with going to get tested. So I just wanted to reflect that from the call last week, is that there was less of a concern about getting things exactly right on a potential MOU that none of us have seen, and more about focusing on what's happening, is that people are getting sick. I mean, we had another 130 cases in the last 24 hours. That was where we wanted our public health officials' attention. So just wanted to reiterate that from the call.
So given this discussion, and forgive my ignorance on this, what role does the council play in this in being able to make this policy change? Do we have a role that we can actually require that change be made? Or where is that originating that we need to put our energies so that we can affect that change so we can get this policy removed?
Sure, I'll still have a couple of questions.
Oh, I'm sorry, Councilmember Glover. You did mention before you had some questions. I'm sorry, without a hand, I forgot.
Well, yeah, sorry, I had to come in on the phone. Was that Mr. Cooper about to answer that question?
Yes.
I was, but I can wait.
No, I would like to hear it because it kind of centers around some of the stuff I want to ask, or maybe even it may narrow what I'm going to ask. So I would like to hear your answer, please, sir.
So there is a late resolution that's in your amendments packet that will be considered by the committee tomorrow that requests the health department to stop sharing this data in keeping with the state's decision. If that resolution is passed and the health department decides not to comply with that request, there is probably a better than 50% argument that the council can prohibit that by ordinance. I've been reviewing the language in the charter over the past few days, and there is language that refers to complying with regulations adopted by ordinance. that's typically in order to, to implement some kind of program and not necessarily a prohibition on some other action that they otherwise had the authority to do. So it's iffy, but it's probably possible to do by ordinance.
Thank you, Mr. Cooper. Councilmember Glover?
Okay, so Mr. Cooper, I want to go down this a little bit further then. So it's a late file, as long as nobody raises their hand in objection to it, it can come on the floor and we can discuss it and vote it, or hopefully discuss it in committee. And so that's, thank you for answering that. Second is, with regards to the HIPAA, because this is the world I live in, to what extent, if the information is shared, how far out can that information be given? Because I know in my world, you just don't do it. I mean, it literally requires a court order for me to discuss anything with anyone outside of either my client or anyone who has the same rights inside of the HIPAA laws that I have as a licensed and registered agent.
So my understanding is that the information can be shared with law enforcement, but it cannot go any farther than that. So like just because law enforcement has it, it doesn't then make it a disclosable public record.
Okay, and that was where I was going with that, because I'm like, I can be told things, I can't even discuss it outside of that period. And that's what I was trying to get to the bottom to. All right. Thank you, Chair.
Thank you, Councilmember. Councilmember O'Connell? You are still muted.
I think for some reason, it's slow to unmute. Anyway, thank you again. I did want to clarify that I've already requested from the council office that if we do not see a response to the request in this resolution, that we do follow that with companion legislation that will seek to disrupt the data sharing. So, and I'd like to do that, again, mostly for the sake of transparency here, because I do think there are some appropriate uses of data that are still protective of privacy. But I think right now we have so many people that are expressing reluctance or even fear about the process of getting tested. And they're, as I've got construction crews at work sites that are facing the prospect of mandatory testing, and they're like, well, wait a second here, am I putting myself at risk in order to maintain my job? I'm extremely mindful of that, because we have not said how we are going to use that data. I mean, so I think we need clarity of policy. I think we can tighten this up. I think we can get this right. But so far, we have not heard from the administration or health officials a clear intent to do so.
Thank you, Councilmember. What is the difference, and perhaps Mr. Cooper can address this, what is the difference between providing that data to law enforcement and, as Councilmember Sepulveda suggested, that perhaps emergency services 911, that would also, are those records not a matter of public record, 911 records, so that would actually perhaps result in a broader expansion and spread of private health data through 911?
My hope would be that we can anonymize some of this, right? So that it's basically shared as an associate piece of information that only shows on a dispatch as basically metadata. It does not include name. It does not include any other information other than such as triggered by the availability of the address. So there are ways to do this, and I'm saying this as somebody who in IT has worked on systems that do this kind of thing, where it's singleton records against secure databases. Like, there is a technological capability to do this, but you've got to get the policy right.
Councilmember O'Connell, is there an expense associated with doing something like this, an additional expense?
That'd be something that probably ITS or ECC would have to weigh in on. I don't know. Again, I mentioned before, what I'm hearing here is that we also have seem to have a real problem with communication and transparency from the health department in terms of this, the health. And so we need to come up with a course of action and determine what it is that we want from
the health department in terms of all of this information about the testing and devise a course of action to how we are going to get that to make sure that we get the information that we need and that we are entitled to. So I open the floor to any ideas about a possible course of action to compel the health department to give us the information that we're seeking. Councilmember Sepulveda?
Yes, thank you, Vice Chair. I just wanted to make one more point, that in one of the calls that I had with some of the Southeast Council members, I think a huge concern of ours is that we have the majority of the cases of COVID in this city, and our part of town needs a lot of help. And so some of the questions that we had were also centered around what percentage of that data that they are receiving has actually been used. I don't know the answer to that. Is it a significant amount or is it a low amount? I think it also puts us in a tough position, and I think it's very unfair to put us in this position where we can lose the trust of constituents. I don't want it to be, well, if you keep pushing this narrative, you're going to incite fear in the immigrant community, in the African American community, in your district in general. And I don't think that is a position that they should have put us in. I think that we need to look at what other cities have been doing. I think we have lost a lot of time. We lost a lot of time. Other cities figured this out, and that's why I'm saying we could figure it out too. If it's on the front end with 911 dispatchers, if it's figuring out, I think we also need to figure out. Councilwoman Porterfield has said this before. When we bring inmates into our prison system, I think that is one of the main points that they are also making, that that's why they're sharing the data, because they also have a fear about bringing someone who has tested positive for COVID-19 into the prison system. So that is another aspect that we do need to address. But I just wanted to get that point across.
Thank you, Council Member. Do we know if there is, in fact, any data on how many first responders in cities like Nashville have actually been exposed to COVID? Councilmember Porterfield?
When I asked that question, this was maybe a week or 2 weeks ago, so the number may be different now, but the information that I was provided was that there had only been 3 cases. I believe that may have just been for MMPD, but I'm not sure if that was for MMPD and first responders. But that may be a question that we want to direct to Chief Swan with the Office of Emergency Management, unless there's someone on the call that can answer.
Does anyone have information on that? What other steps do we feel that we can take as a committee and as a council to get more transparency and more effective communication from the Metro Board of Health on this issue? I would think at the very least we could start with a letter outlining what we would like and some of the information that we would like. And Mr. Cooper, perhaps you can answer this too. How much power, again, I apologize for my ignorance as a new council person, but how much power does the council have to compel that information from the Metro Board of Health?
I think the council could pass an ordinance requiring the health department to provide a report to the council with certain information, as long as that information was public record.
Councilmember Porterfield, your hand is still up. Did you have something else that you would like to add? Does anyone else have any issues or concerns?
I do care.
Oh, thank you. Councilmember Glover?
So let me, Mr. Cooper, and I want to make sure I ask the question properly. I know that Councilman O'Connell has, he brought up a good point about moving and doing this and et cetera. And I don't know if the councilman wants to answer the question or you do, but in the event satisfaction is not met, or in the event the resolution tomorrow night is not dealt with as committee and or the council sees fit. And I guess this question is to Councilman O'Connell, if that's appropriate. Are we on kind of a standby move for this, or where are we as far as the lineup is concerned on the progression of how this should transpire over the next 24 hours?
Councilmember Glover, I would say for my part, I was going to see basically where we were by the end of the week. First, see how for Sledge's resolution fares in the body, and then second, see if the administration or Metro Health respond to it in any meaningful way. And then by Friday, try to hit a filing deadline as appropriate to get this moving.
Good. Mr. Cooper, is there anything that can be done in the interim in the event that and I'm asking hypothetical, in the event the resolution or whatever does pass tomorrow, is there anything in the interim that can be done to make sure this information is not being shared in a way that it should not be shared outside of only the proper channels? Maybe that, I don't know if I'm asking the question correctly, but I hope you understand what I'm asking.
Sorry, I was getting another call in that I had to mute.
It's me, Sharon.
Councilmember Hurt?
It is. Sorry, I'm so late. My other meeting.
That's okay.
Yeah. When,
Mr. Cooper, do you need Mr. Glover to repeat his question?
No, I heard the question. I think the question is if the resolution does not pass tomorrow night, what action can be taken to prevent? But I don't think the issue is, I mean, the information that they are disclosing, they are now lawfully allowed to disclose. So it would take some kind of ordinance to make that an unlawful activity. So that's what Councilman O'Connell is talking about for filing. And again, it's not clear that the council has that authority. We're kind of in uncharted territory on that issue.
Okay, and I appreciate the clarification because I'm just trying to follow all the components of this. All right, thank you, Chair.
Councilmember Hurt is actually the chair of this committee. Councilmember Hurt, would you like to weigh in on this discussion? I know you're late, but I'd like to hear what you have to say on any of the issues, something you'd like to bring to the fore.
I'm not exactly sure what all you've discussed. Did you talk about having some type of letter sent in regards to the communication improvement with the director and the executive leadership team of Metro Health? Did you all discuss that?
We did not.
Okay, so just wanted to let the committee know that there has been concerns brought to me in regards to the lack of communication between the director and the staff. And they're basically just asking for a better communication between the two. And it was similar to some of the current concerns that council members spoke of in CMC meeting last week, and how there seemed to be a sense of not cooperating with them. And I know that the transition for Dr. Caldwell has probably been a very difficult, considering that he came the day after the tornado. So I was going to suggest that we might send a letter indicating that we'd like to see more communication between the department as well with council members and within the department itself. Some improvement. And I don't know if we want to put some kind of timeline in regards to that, and not necessarily at this gathering, but at some point in time, I really would like to talk about succession planning, because I would not like for us to be caught in the same position that we have been over the years with not being able to keep director in an extensive time. And I know one of the persons who would always fit in as the interim is no longer with the health department, Sammy Ariola. So I do think that that's worth a discussion as well. But I may have gone and said a little bit too much right now. So I just want to address the whole communication issue. And I'm trying to drive while we talk too, so forgive me.
The lack of communication and transparency has been part of this call, at least in terms of how, the relationship between the Board of Health and Dr. Caldwell and the council itself and the task force.
Right. Okay, so and with that, there's also the communication with the team, his executive leadership team. So did you all decide on what you would do as far as the communication between him and the council?
That is something we were just starting to discuss.
Oh, okay. Okay. Well, the thing of it is that there seems like there's some consistency with the lack of communication. So we might want to address that.
We're losing you.
In some way, I guess is basically what I'm suggesting. Yes, and I'm driving. I'm in a wooded area. I'm sorry.
No worries. So do we want to decide on a plan of action beyond what has already been talked about here, which is seeing how the resolution tomorrow night fails, and then following the lead of Councilmember O'Connell, moving ahead with potential ordinance, or moving ahead with when we see what happens at the end of this week? Should we decide now that we as a committee would like to work on drafting a letter that we can then bring in front of the committee at a later date and approve?
I think that sounds great to me. That sounds like a plan. I like that. And it keeps us from overstepping our boundaries as well, but just, making sure that we indicate that it is a concern that has been brought to our attention, but not trying to run in his department or do anything that's outside of our jurisdiction.
Councilmember Sledge, you said you have asked for some specific information that each on the task force calls.
Yes.
Information again on the task force call this Thursday and seeing what the response is, or do you feel like we should take some sort of action before then to do what we can to unofficially compel that information to you to get to the response on Thursday?
I would leave that to the committee. I think if I can just recap sort of, and I hope I'll get this accurately because I know several members have asked for different things, but consistently what has come up on the calls has been more consistent race and ethnicity data. It seems a little spotty. It seems to go kind of 1 week we get it, 1 week we don't. questions about how data is being used. There's a sort of separate but related question about how the third party that is contracted to do the testing, do the results announcing, uses data as well, and we've gotten no response about that. And I would defer to members Sepulveda and Porterfield because they've been on the call, I think, as consistently, or perhaps more than I have, if I'm forgetting things outside of those two main buckets.
Councilmember Pulley.
Thank you, Chair. I have a couple of statements and a couple of questions. I've not been on these calls, so I certainly respect the fact that the information that's being brought to us by the members. A couple of things that compel me are some of the points that Councilman Sledge made and Councilman Sepulveda made about concerns about distrust in the community providing this. Conversely, I also have an understanding of the need for law enforcement to have some of this information. To the point made about information sharing on the part of Dr. Caldwell and his office, has anyone reached out to him or them and let them know that we have these concerns?
Councilmember Porterfield.
Yes, thank you so much, Councilman Pulley, for asking that question. We have been speaking with them we've had several calls with them. When this information was first released, we had a call. There's been information that I, in particular, asked for with regards to some of the testing. Some information with regards to the number of people infected in Southeast Nashville. And we've been sharing our questions and concerns with them since about April, I believe. So to this date, still don't have the information that was requested of them back in, I'm pretty sure it was April, maybe mid-April. But yes, we have expressed several concerns. We have asked them questions. We've asked for information that has not been provided. We've been on calls with Caldwell and Chief Anderson to express these concerns. And we've spoken with the mayor's office. So we have extensively had multiple conversations with multiple entities without any information. I do believe that Chief Swan has been very supportive in trying to find solutions and work with us to make sure that we're getting information. But unfortunately, we're still lacking the information that was requested of Dr. Jahangir and Dr. Caldwell, and the suggestions that we made to Chief Anderson, we've not, it just hasn't gone anywhere.
So I've heard a lot of questions that were asked seeking specific information that haven't been responded to. And we reached out and told the entities, Dr. Caldwell and the like, hey, let them know, hey, we're not getting the kind of response that we want out of this stuff. So we expect better. Have we made that that kind of communication with them, asked those kind of questions?
Yes, sir. That was made. I would say probably a week or two after the first request. It was brought up on one of our council briefing calls that okay. that we had not received that information. So to be clear, there are two separate things that we're talking about here. There was information requested by the Southeast Council members to address the fact that Southeast Nashville has been a hotspot with coronavirus cases. So there is information that's been requested initially. So that was the April conversations. There was no follow-up from that. We didn't receive that information. Since then, we have found out that this information was being shared, and we tried to work with Chief Anderson and Director Caldwell to look for some solutions to, again, keep our first responders safe, also protect the privacy of the community, as well as keep, if someone is testing positive and then they are getting arrested, making sure that that body, that they are not bringing the virus into possibly spread the virus within our jail. So we have tried to provide some suggestions. We have asked for solutions. We have asked for more clarity on the process. We've asked that something be done about it, so that they are very aware of our concerns, and it just hasn't gone anywhere.
Okay, my point is simply to ask. I'm not. I think it's very important that the people who are dealing with this issue get the information that they need. I certainly support that. My question was just geared toward the letter. You know, I'm all about asking and letting people know on the front end with a phone call or whatever. Hey, man, I'm not getting what I want out of you before I go to the trouble of sending a letter in an official capacity and doing that. So it sounds like to me, based on what I'm hearing, that we have had some level of communication. So I certainly would support if you guys wanted to send that kind of letter. I'm a little hesitant to really go any further than that, given the nature of the things that we have already in the pipeline with the resolution and the things brought up by Councilman Sledge and Councilman O'Connell, especially with no more knowledge than I have of the topic. So again, I appreciate all y'all's work on this, and I certainly empathize with what you're having to go through.
Councilmember, did you have a response to Councilmember Pulley?
Sorry, Chair, were you calling on me?
Did you have a response to Councilmember Pulley?
Yes, I wanted to add, Councilmember Pulley had brought up, if he had brought up about the mayor as well, and I just wanted to add, I know several of us may have had one-on-ones with the mayor about the budget, and I had mine on actually the afternoon after that call on Thursday, and I did bring it up to the mayor. I brought up this entire topic to the mayor, and we had a healthy conversation about it. I don't think we came to any, I think we respectfully disagreed, and I don't think we came to any sort of different conclusions so far. But I did let him know and had that conversation with him, and I had let him know kind of what the tone of that call had been that morning. So I just wanted to make sure since Councilmember Pulley brought the mayor up, and I don't know how many people I've talked with him since, I wanted to let him know at least I had reached out to him when we had that budget call.
Appreciate that very much. Thank you.
Councilmember Hurt? Councilmember Hurt?
Okay, so I also wanted to add on to what Councilmember Porterfield said, because during that same time, we were requesting information regarding the Black community.
We lost you, Councilmember Hurt. Councilmember Hurt? We'll come back to you. Councilmember Sepulveda?
Hello?
Yes.
Councilmember Hurt?
Could you hear me?
Yes, we can hear you now.
Okay, so what I was saying is that along with the things that Councilmember Porterfield expressed, during that same time, we were asking for information regarding the Black community, because, you know, across the nation, they were talking about how that it was a higher number of Blacks who were showing fatality in this. And it took some time for us to get that information. And so it seems like there is some kind of pattern with the lack of communication. And likewise, I think that this is also some of the things that his staff or the board of Metro is expressing concerns. The other thing that concerned me is the sharing of the data, because I think that we may be liable to give out that type of information without there being an existing memorandum of understanding. I know with the work that I do with StreetWorks, that information is not shared in terms of the testing. That information, when we test, we send the information to the health department, but it is not shared at all with those individuals.
We discussed that earlier, and you and I can
of their
after the meeting.
Individual's information is not shared. So with that, not sharing for HIV. Okay, all right, good. Okay, I just wanted to make sure that that was addressed.
Yes, it was.
Thank you.
Councilmember Sepulveda, we will wrap up this meeting with you.
No pressure. So I think we're all a little concerned and frustrated because we have been asking for this information for some time. I know that in the past they had mentioned that they were having some issues because they needed some of that information from the state. I think it's, I know they have a very hard job. It's a hard job, and there are a lot of things going on, and no one could imagine this happening. I just think stakes are high, and we need to come up with a solution, and we should have had one yesterday. But I will be the first one to welcome them to sit at a table with us and with other marginalized groups to try and figure out a solution, and while making sure that we also protect our first responders. But I would encourage all the council members to support the resolution tomorrow and stand with us.
Thank you, Councilmember Sepulveda. So it is noon, so I want to call this meeting to a close, but just to recap, we will, as a committee, will begin to draft a letter to the health department asking for more transparency and for the specific information that we want to receive from them on a regular basis going forward. And we will see how the resolution goes tomorrow night, and the other legislation from Council members Pulley and Sledge, and revisit that at our next meeting next week if we are not satisfied with what has happened at the end of this week. And with that, if no one else has any comment, I will draw this meeting to a close.
Thank you, Vice Chair.
Thank you so much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.